We've just heard how AI can potentially pose a threat when used or misused in the legal world. Well, there's also good to come of this emerging technology. Here to share more is our good friend, Dr. John Schnorr, fertility expert and co-founder of Coastal Fertility Specialists. He is also the founder of Fertility, which uses AI.
Right.
So glad to have you back.
Right.
We love having you on this show because, first of all, just your sheer presence means that there's new, beautiful life coming into the world, and the program, the software that you developed, is only helping in that effort.
Right.
So tell us a bit more.
Yeah, no, I think it's smart to be cautious about artificial intelligence. I don't think there are many people in the world today that want their doctor to be an artificial intelligence computer system. But wouldn't we want our doctor to have his or her skills enhanced through the use of artificial intelligence? And so the application we created, for example, helps the doctor and nurse figure out where the eggs are in the ovary, how quickly they're growing, and it does it in 1/10 of the time that a human would do it. And so the relevance is that use of artificial intelligence with our application makes it so that a normal 10-minute uncomfortable ultrasound for a patient literally is 20 seconds start to finish.
Wow.
And it gives the clinical team the ability to see the images every day, 24 hours a day on any device they have, so they can verify that it was accurate and then make any changes that they feel are necessary. So, you know, my belief is artificial intelligence used the right way can significantly improve healthcare. Yeah. Imagine it helping your doctor understand what the differential diagnosis could be, so your doctor could think through some of those options, or summarizing the patient's medical history altogether in one page so they had all the information they need to kind of move forward and provide better care for a patient.
Certainly. Well, when put in capable and altruistic hands, then it does good. So the application that you created, when was that released?
It was January of 2021
yes.
is when it was released.
It was just a couple of years ago.
It needed significant FDA review. So, you know, in healthcare, artificial intelligence generally needs a review from the FDA to make sure it's accurate, to make sure it's not learning on its own in a bad way, to make sure it's being used for the benefit of patients. And then it gets continued FDA scrutiny where they can audit and check it random times just to make sure it's being used the right way.
So can you tell us, can you take us down one example of how that application has helped your patients?
Yeah, so we have lots of patients with infertility from endometriosis, and endometriosis is a disorder that causes a lot of pelvic pain. That pain is worsened by ultrasound, so when they have ultrasounds, they have a lot of pain with ultrasound. And so patients get an ultrasound probe put in the vagina to understand where these eggs are, and that's 10 to 15 minutes of pain for a patient with endometriosis. With our application, that ultrasound is 10 seconds per ovary, a total of 20 seconds, making it much more comfortable for the patient with as accurate or more accurate results for the doctors and nurses.
How long did it take you to develop this application?
Probably about a 2-year process, and we literally had to teach the computer system with 90,000 follicles where the follicle was so it could learn those moving forward and accurately make that diagnosis.
You know, when we're talking about artificial intelligence, and now it just really seems to be exploding on the scene, that it's now out there. You know, you can't call it back into the barn. It is out there. But when you were developing this, I mean, this is a couple of years ago already.
This was early on. When I figured out that this might work, there was a new study that showed that breast cancer could be diagnosed on a mammogram with the help of artificial intelligence more accurately than human alone, making me think that we can apply this in a very positive way. Interestingly, we did a large patient survey, and 93% of patients felt that artificial intelligence would improve their care. They were happy to have artificial intelligence. And 100% of patients were excited to know that their doctor could review their ultrasound 24/7, any time of the day, to make sure it was done accurately. And I think those are some of the many ways that artificial intelligence can improve healthcare.
Sure. And the patients that did suffer from endometriosis, and you were able to locate those eggs and time everything.
Eggs quicker, more accurately, and get nice pregnancies. So it's been a big positive.
Oh, that's wonderful. For people who want more information on what you do, where should they go?
So I work at Coastal Fertility Specialists, which is throughout the state of South Carolina, and then our fertility AI company is called Fertility, which is cycleclarity.com.
Is that being used outside of your practice?
Throughout the United States, and we're working on international right now.
Oh, that's fantastic. All right, so that's the next chapter.
That's right.
Very excited to have you.
Yes, ma'am.
Looking forward to having you back soon. Thank you so much, Dr. Schnorr.
You bet.
We're back after this.